Hi, I'm Dr. Erik Mendelsohn, and today I'm going to explain the process of tooth extraction and immediate dental implant placement with bone grafting. In certain situations, when a tooth needs to be removed due to decay, fracture, infection, or trauma, we may be able to place a dental implant at the same appointment as the extraction. This can help to reduce the total treatment time and preserve more of the natural bone and surrounding gum tissue architecture. After the tooth is carefully removed, the implant is placed directly into the jawbone. In many cases, there may be small gaps between the implant and the surrounding bone. To help support proper healing and preserve the bone dimensions, bone graft placement can occur simultaneously around the implant at the time of surgery. Once the implant is placed, healing begins through a process called osseointegration, where the bone bonds directly to the surface of the implant, essentially making it a part of the body. Depending on the quality and density of the bone at the time of implant placement, the area may require 3 months of healing time before the final abutment and tooth can be attached. When immediate implant placement is possible, it can significantly reduce the amount of time a patient must wait to restore their smile, while also helping preserve the natural shape of the jaw and the gums. Thanks for watching, and I hope this gave you a better understanding of how modern implant dentistry can help restore your smile, function, and long-term oral health.